Welcome to Sustainable Health Empowerment's Health Education Series. My name is Mark Bannikin. I'm an internal medicine resident at UCLA Oliveview, and I have been a volunteer with SHE for nearly 7 years now. I have helped participate and plan the inaugural medical mission trip to Cambodia in 2015. This trip was initially called Cambodians in Globalization, which was a study abroad trip with Cal State Long Beach and also a medical mission trip. This is the first in a two-part series about prostate cancer. And this week, we'll talk about, number 1, understanding the anatomy of the prostate, 2, identifying risk factors for cancer of the prostate, 3, identify symptoms you should share with your healthcare provider, 4, recognize that benign prostatic hypertrophy, otherwise known as enlargement of the prostate, is common as men age, 5, identify diagnostic tests, and 6, identify treatment options. So let's jump right in. The prostate is part of the male reproductive system. It produces the fluid that nourishes and transports the sperm. A healthy prostate is about the size of a walnut. If it grows large, which can happen as we age, it can squeeze the urethra, which is the tube that carries urine from the bladder. This causes the flow of urine to slow down or even completely stop, leading to issues going pee. Prostate cancer is one of the most common cancers in men. Some types grow extremely slowly and need little to no treatment, whereas others are more aggressive and can spread quickly. Although the exact cause of prostate cancer isn't known, there are factors that can increase your risk. One factor is age, especially for a man over the age of 65. Age is the main risk factor for prostate cancer. The second risk factor is family history of prostate cancer. If a man's father, brother, or son had it, he will be at a greater risk. A man may experience no symptoms, but if he does, these are the most common. Maybe they have difficulty passing urine. They could have a hard time starting or stopping the flow of urine. They may need to go to the bathroom frequently to urinate, especially at night. They may have a weak stream of urine, and it takes them longer to finish going to the restroom. They may experience pain or burning during urination. They may have difficulty getting an erection. They may see blood in the urine or semen, and they may experience frequent pain in the lower back, hips, or upper thighs. Be aware that usually these are also symptoms of a benign, non-cancerous condition called BPH, which is benign prostatic hypertrophy, or more simply, enlargement of the prostate. And this is common with increased age. This is not a cancer. Symptoms of BPH, which is the enlargement of the prostate, can be treated with medication or a number of new procedures that can reduce the size of the prostate. These symptoms might also be signs of an infection. You should see your doctor if you have any of these symptoms. Your doctor is likely to do at least 2 tests. The first is a digital rectal exam, which is when the doctor uses a lubricated glove to slide a finger into the rectum and feel the prostate through the rectal wall for any hard or lumpy areas. The second test your medical provider is likely to perform is a blood test called PSA, which stands for prostate-specific antigen. If your results are higher than normal, it can be a sign of enlargement, infection, or possibly cancer. If any of these tests are not normal, your medical provider is likely to order additional tests to determine if cancer is present. These may include an ultrasound to get a picture of the prostate. The only sure way to determine if cancer is present is through a biopsy, which is the removal of tissue from the prostate for examination. If cancer is present, the doctor will want to determine how large it is and if it has traveled anywhere else in the body. This can help them determine what the best treatment is. This process is called staging the cancer. Let's see what we have learned so far. A man with prostate cancer may not have any symptoms. Is this true or false? Yes, this is true. What is the only sure way to diagnose prostate cancer? A biopsy, transrectal ultrasound, a PSA test, or a rectal digital exam? Like other cancers we have learned about in this series, a biopsy is the only sure way to detect cancer. Treatment options for prostate cancer include all of the following, either alone or in combination. Active surveillance, which is also known as watchful waiting, surgery, radiation, hormone therapy, or chemotherapy. Remember, what's good for each person may be different, and it will be up to your healthcare provider to determine the best treatment. Today we have discussed prostate cancer, its risk factors, symptoms, and diagnosis, as well as the benign enlargement of the prostate called BPH. Next week, we're going to explore the various treatment options in greater depth. Thank you for tuning in, and be sure to check out our next episode and all of the episodes in the health series. We'll see you next week. Here's to good health and good habits.